Life-altering trauma creates ripple effects far beyond the initial injury, impacting survivors, families, and entire communities. Our next guest, Matt Kalina, is transforming trauma recovery through the power of shared experiences. As founder and CEO of Tandem Stride, Matt is building a virtual peer support platform that connects trauma survivors with mentors who have journeyed similar paths. Inspired by his brother's journey as a bilateral amputee after surviving a train accident, Matt combines his extensive healthcare AI technology background with deeply personal insights into trauma recovery. Join us to discover how Tandem Stride is revolutionizing post-trauma care by creating meaningful connections, reducing readmissions, improving mental health outcomes, and helping survivors rebuild their lives through the profound impact of lived experience. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Matt. A big welcome to our podcast today. I am so excited to have you on, my friend.
Great to be here, Mike. Thanks for having me.
Well, given your dedication to improving health outcomes through shared lived experiences after your brother survived a pedestrian train accident, leaving him a bilateral amputee, I'm honored to have this very important conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Matt, it's almost time for our community to learn how you and the Tandem Stride team are building a healthcare technology company that is focused on creating connections and transforming trauma recovery with the goal of improving outcomes and quality of life for trauma survivors. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Yeah, Mike, I think if I had to think of one piece of advice, it would be to get started and take action. I honestly feel like there's so many great causes and missions out there. It doesn't need to be the one that you develop and create on your own, but entering the conversation, leaning in and getting started instead of talking yourself out of doing something, I think is the biggest opportunity for everybody. There's so many reasons to sort of hold yourself back. I think that most people should just jump in and get started, and they'll be happy to see what comes out the other side.
Absolutely love this advice. Actually, you and I were just chatting before we hit record that we just recently celebrated our 300th episode on the podcast. 5 years ago, I had no idea what the hell I was doing with this thing. And as one of my mentors always tells me, Matt, start before you're ready, right? So I flipped the microphone on and tried a bunch of things, failed along the way, and here we are. Now able to publish over 300 episodes and get to hang out with amazing, good troublemakers just like yourself. Matt, you have a history of doing this. I want to share with the community. I was very, very fortunate to work alongside you while we were both at Olive. And you were there on the early days of a storied mission and company that was really pushing the envelope in healthcare technology. I take it this notion of just get going, starting has always been with you from early days, yeah?
Yeah, absolutely, Mike. I mean, it was great when we crossed paths. Olive was certainly a heck of an experience to see like a high growth startup in healthcare trying to do something different that not everyone gets the opportunity to be exposed to early in their career. And I was there for quite a while. I think that's what really opened up my eyes to if there's a big mission that you have, a bold task to accomplish. What do they say? The easiest way to eat an elephant is one bite at a time. You've got to have that first bite and you've got to get started.
Well, Matt, I'm big bone, so I have no problems taking that first bite. I'll get after it anytime, any day. Joking aside, you're absolutely spot on. And that is exactly what we were doing at Olive. It was one heck of an experiment. And the folks that we were able to work alongside each other was just absolutely remarkable. I absolutely love this idea. Get started, just get going, right? And you know as well as I do, building a company is definitely not a straight line. There are a lot of twists and turns along the way. I'm sure that's the case here at Tandem Stride as well. We're going to talk about how this all came to be, where you guys are as a company, this incredible, incredible mission that you have in front of you and your team and our country and beyond on what you are doing to help trauma survivors. We're going to unpack all of that and more after we get back from thanking our community champion sponsor. Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow. All right, we are back with Matt Kalina, founder and CEO of Tandem Stride. Matt, just start at ASAP. Even if you're not ready, start, get going, as you said on the front end. Incredibly important. And you're doing exactly that at Tandem Stride. I know this has been a personal journey for you and your family and your brother and all the things that you have experienced along the way with the accident that happened. We'll discuss that, of course, and talk about how this came to be, the whys, the aha moments. Where were those kind of gaps in the marketplace? What did you experience? And because I know exactly how you operate, Matt, you're not just going to go and build a company. You're going to go and study the market. You're going to get end user feedback. I know exactly how you operate. So I'm sure you did a lot of that. So we'll discuss some of those signals that happened in the marketplace to help validate launching this company now getting close to 2 years old. That's incredible in and of itself. Then, of course, you got to talk a little future state. We're going to pull the crystal ball off the shelf, look a little future state. Why is this important? We haven't really talked, I'll be honest with you, we really haven't talked about trauma recovery and trauma survivors on this podcast now 300 plus episodes in. We need to bring this topic more to the forefront, just like you and the team are doing. So what should we also be looking at future state as well? Looking forward to hearing your thoughts there. Of course, where the company's going as well. And then we can't let you go until we ask how we can be helping you as well. So we'll dive into that. But of course, Matt, let's rewind the clock a bit. How did this all come into focus? We kind of teased it on the front end, but give our audience a little bit of taste of how this came to be with Tandem Stride. And then we'll dive into how everything's going today.
Yeah, Mike, it's a really interesting story. I mean, I think it's deeply personal to me. I spent 8.5 years at the last company where I met you, Olive, that was on an interesting technology company raising over $900 million. And when I joined, it was probably like 10 employees growing to about 1,200. But really the motivation behind what started Tandem Stride actually started then. The whole reason I got involved into, the health tech community was because I was frustrated with the healthcare system, because my brother, who's a year and 6 months older than I am, we were both undergrads at Ohio State. This was about 12 years ago, and he was actually run over by a train and became a bilateral amputee at the age of 23. So wakes up in the hospital bed, missing both of his legs and a pinky finger, and had no idea where to start to put his life back together again. And I got to sort of witness that journey. And that's what took me to focusing on healthcare and healthcare technology, because I just felt like it was a disconnected system that wasn't designed to allow people to be successful. And that was really frustrating to me. So it's crazy to fast forward 12 years and having the experience and exposure I have had through my time at Olive and just in the health tech ecosystem for the last decade to come full circle and start to think about a mission that's really personally motivating to me and what it would mean to make an organization or build an organization that can have an impact on a place that I know deeply, because my family's navigated it. So it's really interesting to see over that long arc of time. It's been 12 years since my brother was laid up in the hospital bed and had some of those conversations with me about where he thought his life would be and how different it was. And he's, obviously never pictured his future the way it ended up. But I had a great experience over that decade or so, understanding what it means to build teams that have a mission, how to go out and get partners with investors, hospitals, health systems, and insurance companies to rally around a cause that has a transformational impact. And now I'm taking that on the road to something that's very personally motivating for me with the work we're doing at Tandem Stride.
Absolutely appreciate you teeing it up and sharing those personal moments, with your brother and with your family. Before we dive into a bit more as in regards to who is Tandem Stride, the technology you're building, the whys, let's continue to go back to those moments in time with your brother and the accident that happened. and maybe obviously what he experienced. You kind of already mentioned that. But then, of course, what you guys experienced as a family, and then kind of from that moment to launching Tandem Stride, what did you see in the marketplace? Or more importantly, what did you see lack thereof? Where were the missing gaps? Where were the needs, if you will, for trauma survivors, whether it be the person that experienced the trauma or loved ones or friends? What were some of the themes that you were seeing along the way from that moment that accident happened with your brother to leading up to founding the company?
Yeah, that's a great question, Mike. So as you could imagine, a life-altering injury where everything changes in an instant is something that's so difficult to manage, especially for the individual affected. But there's like this concept of second trauma, which I've come to understand from being close to this space. It's the community around the individual that's affected by it. Obviously, like I got a call from my parents. They were 2.5 hours away in Cleveland, and they said, your brother's been in an accident. They told me what happened, but I don't remember it. I just sort of floated through the day finding my way to the hospital because I was the closest person to my brother. And I remember walking into his hospital room and he had a bandage on his head. And I just felt like the breath get pulled out of my lungs because I didn't know what had happened. And then sure enough, like he sees me, he smiles, and he's himself. And he seems to be in very good spirits and welcomes me into the room. But it doesn't take long for me to realize that the way his bed was situated, that it was much shorter than I would have expected. And it was in only talking to him did I understand that he, in fact, did lose his legs. And this was not something that he was going to recover from quickly and be back out on campus with me in a few days. And that was really difficult. And I think what was really tough was just the long time horizon of what his recovery would be, getting into a wheelchair, physical therapy, then getting up on prosthetics. This was all stuff I had no idea about. I remember, even talking with my parents and my sister. I mean, we felt entirely alone in this experience. We had doctors and nurses that, would give us advice, encouragement, or guidance. But in some cases, they almost felt a bit desensitized to it because they see it so regularly that there's kind of some details that are shared matter-of-factly. And I remember we were there and the doctors were telling us all the things that could go wrong with my brother. And we had just received news that he had lost both of his legs and a part of his hand. And we thought that was enough. And my dad passed out in the emergency department because it was just too much for us to process. And I think that's something I've noticed in a lot of other trauma survivors. So my family, we started a nonprofit shortly after my brother's accident because we realized that most people are navigating this system and they feel like they're the first people to go through it. But the reality is that there's a million other people across the country in the US that experience the same thing. And all of us feel like we're doing it for the first time. So engaging with others who knew this, there was a level of trust and understanding that you get through someone else who's been in a life-altering motor vehicle accident or whatever it might be. It may not be the exact same injury, but that material disruption in your life is very unique. And when you find people that have been through that, which is a lot of people, the sense of belonging and understanding that you have is something that can't be replaced. It's something that it's the level of empathy and understanding you don't get from doctors and nurses. And that was a core tenet of what I felt was really missing in this system is the empathy layer of lived experience that you just had to learn on your own instead of drawing on those that have gone before you. And that's really what I think drove me to do something in this space. And the work we're doing with Tandem Stride is really anchored on peer support, anchored by lived experience. People that have been in your shoes and have navigated this path before you, helping you navigate the path. I think the school of lived experience is so much better than the classroom on health tech or healthcare empathy. And I will bank on that every day.
Well, let's go there, Matt. Let's discuss kind of that lived experience. Let's discuss how you and the Tandem Stride team are serving those constituents that are affiliated with the organization, touching the technology, et cetera. Let's first start there. Who is Tandem Stride?
Yeah, so at Tandem Stride, what we're doing is we're building a virtual peer support platform for trauma survivors. So we partner with hospitals and health systems, usually level 1, level 2, level 3 trauma centers. These are the places where the ambulance and the helicopters goes after a motor vehicle accident, violent crime, you name it. And what we do is we partner with the staff in the trauma center to recommend an app that the patient can download while they're in the hospital or shortly after discharge, where they can connect with someone who has a similar lived experience to them and really be that trusted dialogue, the questions you have, like the things I didn't know if I should say to my brother, you can ask somebody who's been a brother or has been in that position. And I think that's what we're trying to do. I think the really interesting part of this is just providing the peer connection piece allows people to have a lot of healthy conversation about how to show up for people in this circumstance. And what we're seeing is by partnering with these trauma centers, we're actually able to address a lot of needs for people. So a patient or a family member might download our app and create a profile to connect with a peer. But a lot of times what ends up happening is they start talking about all sorts of other things that we can support them on. Things like, hey, I've been in the hospital a really long time. I'm not sure if I'm going to be able to go back to my apartment. I haven't been able to pay rent. You think about all these things that actually get in the way of the clinical care. You know, doctors and nurses are saying, hey, make sure you show back up for physical therapy and send them on their way. But they're figuring out how they're going to pay for groceries. How are they going to rearrange childcare? What are they going to do when life comes back into focus? And the way you navigate it is very different. And that's really what we're doing, is sort of building a platform that allows people to engage in peer support and just listening to that conversation and supporting those people on that journey, which includes a lot of complex psychosocial challenges that might come up. 1 in 4 trauma survivors will develop post-traumatic stress disorder within 6 months of leaving the hospital. 1 in 5 ends up back in the emergency department for complications due to that injury. And all of those things can be avoided by making sure that they have a lifeline that they can reach out to, someone that they trust, that they can share their concerns with, and somebody that can be there to listen and connect them with those resources. And that's really where we're anchoring our support in this community.
So it's obviously evident in regards to offering up that support for the trauma survivor and then, of course, their community, family, friends, or otherwise. Can you also discuss a little bit, because we have a lot of folks that tune in that are working within health systems kind of across the nation. What does it mean for them? What have you seen in regards to the value bringing to those trauma centers, bringing to those centers of care? What has this experience been like for those folks? Like you were mentioning earlier, a lot of these providers, they become desensitized, like do X, Y, and Z, and because they see it so much. This is obviously a different way to engage with those patients. What's the experience been like for them?
Yeah, it's been really interesting. And just coming to this as the family member of a trauma survivor, I had a perspective. I think what's been really interesting is as we talk to these trauma program leaders, trauma medical directors, trauma surgeons, and others that are part of that care team, is they're sometimes the first to admit, to be like, yeah, our primary objective is to make sure this person doesn't die. And then we put them off into the world and we really hope that they don't come back because of some sort of follow-on issue or complication to their injury. And we know we're not great at empathizing and connecting with these people because we've got another ambulance coming. We've got another helicopter landing on the building. And we've got another case that we need to go in and help make sure this person doesn't die. I think one of the really unique things that happens is peer support is very well regarded in like substance use disorder, alcohol abuse, all sorts of other areas as a way to improve outcomes. There's actually a ton of research that's been done in the trauma space, and engagement with a peer support program can be tied to adherence to follow-up care recommendations, improvement in outcomes, reduction of post-traumatic stress disorder, diagnoses, so on and so forth. So the outcomes and reduced avoidable service utilization is there, so much so that the American College of Surgeons has put out some recommendations for level 1 and level 2 trauma centers to offer a peer program or a survivor program. So really that's where we came in, is we saw that most of the peer programs that exist today, they had such a hard time recruiting and retaining a localized peer network of their former patients, because most of them had the patients coming into the hospital, where my brother's on 2 prosthetic legs. He gets around just fine now, but it's kind of a pain in the butt to get to a hospital if you're fully able-bodied, and navigating that system can be tough. So what we did was we looked at the fact that the research was out there. This is something that the community, the trauma community, knows is valuable, but there's an access issue. There's a distribution issue. And so what we did was built a system that allowed virtual peer support to happen. So that way it's not confined to only when you're in your room and there's a volunteer available in the hospital that's able to navigate to you. It can be whenever you need it. It can be after you leave the hospital. And what we're seeing is, on average, I think our longest patient that we've had in there has been active for 8 straight months, every few weeks, talking to their peer mentor. And, we haven't been around very long. So 8 straight months is like the entirety of the time that we've been offering this service. So it's really cool to see some of those things come into focus as we support this population. But it's really about making sure the hospital that has all these great services and things that they offer, that they don't get out of touch for people that have a difficult time returning to the system. And that's where I think peer support and engagement with us can make sure that you're supporting the patients long after that journey. And honestly, most of the trauma survivors or the trauma programs that we talk to in these hospitals are extremely receptive to this offering because they know where their focus is and they know the complicated road ahead of most of these people.
Another topic that I think, you and I chatted about in a previous conversation a number of weeks ago, and it was a little bit of a light bulb moment for me, and keep me honest here, Matt, but you mentioned, hey, medicine, surgery, science, the way to put a body back together has gotten so good that the survivorship rate, if you will, of trauma incidents just writ large versus years ago has just skyrocketed, right? So then you start thinking about the other side of that. Now we have a larger pool of survivors, but what are we doing on the other side of that survivorship, right? And so if we don't have these types of solutions in place, if we're not thinking about it like you and the Tandem Stride team are, this problem can only will continue to get bigger and further exacerbated. And so then we start tying it back to another topic we talked about is the sheer dollars and cents, right? And you kind of already alluded to it. When you start thinking about readmits, whether it be complications, infection, whatever that might be, and then like you mentioned as well, we can start going to behavioral health and substance abuse and otherwise. What are those downstream effects if we're not taking into account today of that higher survivorship rate and making sure that we're taking care of those survivors kind of post-incident? Yeah.
Yeah, I totally agree, Mike. I think our conversation before was really interesting. And I noticed this with the first thing I did when I started going down this path, I tried to prove to myself that this was not a worthwhile cause and was not a commercial opportunity that was worth pursuing. So I talked to everybody. I talked to people that were part of the American College of Surgeons Committee on Trauma, the American Trauma Society, the Trauma Survivors Network. And I talked to all of these folks. And what I realized was most of the quality improvement initiatives in trauma care have been focused on pre-hospital and during hospital quality optimization. And it's really focused on mortality rate. It's about how can we save the most people? But we're at this point in advancement and understanding of the surgical practices and stop the bleed training for paramedics, all this stuff, that there's a heck of a lot of people that are surviving. And you're seeing this also, this trend is emerging in a lot of other areas. When you think about companies like VivorCare, for example, that's focused on the survivorship movement in oncology and cancer treatment, we're getting to a place where there's a lot of people surviving. So it's not really like, how do we make sure these people don't die? We're at the point of like, a lot of people are living. And it's how do we improve the quality of life of those people to return them back to a place in society that they maybe were close to before. And I think that's what's really interesting about thinking about survivorship in this way. It's sort of the next frontier. I mean, I was blown away. I mean, I looked at some of the research out there. 140 million people globally each year have a permanent or a temporary disability because of a traumatic injury. Like that's a lot of people every year globally. And all the complicating factors that you mentioned around the development of post-traumatic stress disorder, anxiety, depression, high likelihood of having a substance use disorder or an opioid addiction following just the prescription of pain meds and long-term pain management of this population. There's so many things. You're 5 times more likely to be unemployed or underemployed following a traumatic injury. So honestly, a lot of our focus has naturally gravitated towards supporting the Medicaid population because they just have such a challenge in front of them. And what we see is that when you have a traumatic injury, you end up on government-sponsored programs and you likely oftentimes can stay there. And we think that we can unlock this school of lived experience on how to navigate the system and help to upskill these people into roles where they can be, from a telehealth perspective, helping be a care navigator for their peer who's navigating an injury that they may have survived 10 years previously. So we have our peer mentors working with survivors today, and we're actually working with programs and apprenticeship programs in Ohio to help certify them as community health workers or peer support specialists so we can add them back into the workforce because we know how valuable that experience is. And I know it because I lived it. And that is something that I would have paid dividends to make sure I had someone there to help me navigate the process a little bit more effectively if it was an option. And really what we're doing is connecting the workforce that is out there and dormant with the need that we all know is so abundantly clear.
Absolutely brilliant and inspiring. I'm ready to go. Put me in, coach. I'm ready. I mean, this is such an inspiring and exciting mission you have in front of you. Let's also talk, Matt. Let's talk a little future state. Let's grab that crystal ball off the proverbial shelf, if you will. Let's look a little down the road, right? Obviously, you found a huge gap in the market. You guys are going after it full tilt. You guys are making incredible progress in such a short amount of time. What are you seeing on the horizon? What should our community who's tuning in, what should they be mindful of with this space? And then, of course, where do you see Tandem Stride in the next couple of years as well?
Yeah, that's a great question. I mean, I try not to think too far into the future because there's so many different ways that I think it would be great to see things evolve. But what we're seeing is a really strong adoption and interest from the trauma community. I mean, we've got just in the last few months, we're onboarding about 50 trauma centers today, which is crazy growth. We were part of an organization that I thought had some pretty crazy growth, but just to see this market pull that we're seeing is something that's, I think, really interesting. I also think when I look at the broader issue here, we're partnering with these trauma centers to sort of recommend peer support as a standard of care, as a part of the discharge plan of these patients. And usually, I think one of the things I'm thinking about is when we look at like digital health companies and just anyone that has a solution to help a particular population, one of the biggest challenges that exists out there is connecting that service or that widget with the person that has the need at the earliest stages of when that can be helpful to them. And I honestly think when we look at our platform, some of the ways that this could evolve in the future is we're engaging with people very quickly after. I mean, we have survivors that shot 5 or 6 times and are downloading our app within 2 days of coming out of surgery. And they're saying, hey, I'm going to be discharged. What do I do now? If you think about just the connection that we have into the acute space where some sort of adverse health event is top of mind for someone or a diagnosis is fresh and new, the traditional like digital health pathway of, working with an insurance provider and finding a list of patients and going and trying to recruit them into some program that can help them with their condition or whatever it might be, we end up actually sort of short-circuiting the introduction of a solution to patients earlier in that journey, where we can actually have a really material impact on improving health outcomes. So you think about it starting with trauma care. I think there's a lot of opportunity in trauma care, but I just think about the engagement mechanism that sometimes feels broken in healthcare, where you have a lot of these digital health companies that are doing direct to consumer strategies to try to get people involved in their app or their widget. But we can take a little bit more of a surgical approach, for lack of a better term, and find these people at the earliest stages of their journey and connect them with things if they have an opportunity to improve outcomes and connect with people early in that journey. And I think that's a really interesting way to see how this could evolve. So for the foreseeable future, our primary objective is to roll Tandem Stride out to as many trauma centers as possible. We're partnering with Medicaid managed care organizations and health plans today to show our improvement in health outcomes for the population. But I certainly think 5-10 years into the future, there's a really interesting platform here that can inject solutions into the system at the earliest stages of diagnosis or recovery for patients. And thinking about that platform is something that I think is really interesting as we look at all the challenges with getting to populations and having an impact. And that's something that's really exciting to me. So while I'd love to see it create value in, a circumstance I happen to find myself in through my brother's experience, I certainly think there's a lot of other areas that something like this could apply to. And healthcare is in such need of an empathy layer. And an empathy layer built on lived experience, I think, is the best way to accomplish that.
Well said. Well said. Well, we'll put the crystal ball back on the shelf for now. We'll bring it back to current state. As you know, Matt, we have an incredible community rallied around the podcast, tuning in, and they absolutely love to help our guests. So what's that one problem, need, or question that you have that our community can be helping you with?
Yeah, that's a great question. I think, as a newer company, we're trying to figure out the right places to connect in and help the system. And I mentioned this previously that we're sort of naturally going towards the Medicaid and Medicaid managed care space for a number of reasons. And one of the things we've been kicking around recently, and I'd love to get anybody that wants to reach out to me after this, is looking at this from like a state program perspective. I think that there's also some trends around some of the pressure from the new administration around state Medicaid programs and return to work requirements and these things. And I think we have a really unique opportunity in the trauma space and elevating lived experience and just peer support in general to sort of help navigationally with high risk populations or populations that have a lot of cost in them. And so one of the things we've been thinking about is there a conversation at the state level? I myself, prior to Olive and prior to Tandem Stride, my time here, I worked for the Speaker of the House in Ohio, Speaker Batchelder, if anyone knows him. And I think that there's a really interesting entry point with the policy discussion and state programs for something like this. So that's something that we've been exploring. And I'd love to get a conversation started around that. I think there's a number of different ways to bring technology to bear. But when you think about some of the challenges that are faced by state Medicaid programs, some of the cost pressures they have, but also just the opportunity, I think one of the reasons why we've seen a lot of reason to lean into state Medicaid is, in many cases, they have much more responsibility for long-term support and services. For example, like if you have coverage from employer-sponsored plan, when you lose your job, you don't have that coverage anymore. So they're not really on the hook to help you in the long term. There's a lot of these things that kind of lend itself well to that space. And I'd like to start a conversation around, state programs and just thinking about how we can have a greater impact for people that we need to show the impact for and connecting them with these services. And I know there's a lot of work being done around mental health at the state level, substance use disorder at state levels. And I think, honestly, trauma is a state problem. When we looked at Medicaid claims data in Ohio, we found about 13% prevalence of trauma conditions in the Medicaid population in Ohio. That's huge. In some cases, that's more than like the heart disease population. And I think that it just hasn't had a lot of attention. I don't know why, but I think that that's where I'm starting to see an opportunity to create a dialogue. One around peer support in general, and the other one around how come we've been ignoring this pandemic of traumatic injury, maybe because it's so complicated and unique and nuanced, but like the material disruption in someone's life, in many cases, it's during their like prime career and education advancement. And it's usually like younger males. And I think that there's something to be said for a state conversation around this. And that's what I'm hoping to start.
Well, for our community that wants to plug in with you and the team and to have those discussions, how do they get a hold of you, Matt? Social media handles, contact points, websites, or otherwise, how do they track you down online?
Yeah, you can definitely find me on our website, tandemstride.com. We're still early enough where I actually have the ability for you guys to schedule a call directly with me on our website because I want to hear from everybody. And I'm always so surprised with just the diverse group of people that reach out. Also, you can find me on LinkedIn. My email is matt@tandemstride.com. I am no stranger to outreach, whether it's an in-mail or an email or something on our website. So definitely reach out.
I can attest, he will absolutely reply to your message. There is no doubt. This guy, he is phenomenal at response rate. So that is for certain. So Matt, thank you for those contact points. Of course, for our listening community, simply scroll on down in your podcast player, find those contact points in the episode notes, or you can head over to our free global online community at passionatepioneers.com. There will be a post for Matt's episode where those contact points will be listed. And of course, you can leave any comments, feedback, suggestions, or otherwise, again, over at passionatepioneers.com. Matt, this has been a long time coming to have you on the show, but of course, we can't let you go quite yet. This is a conversation I have just been waiting to have with you. It has lived up to exactly what I knew it was going to be. But again, like I said, we can't let you go quite yet. We do have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
healthcare is personal.
I love it. Matt, thank you for taking time to be with our community, to share all the wonderful work happening within the Tandem Stride camp. We look forward to continuing to support the journey, have our community involved in such an important mission. Thank you for all that you're doing for so many across our country. We're rooting you on, and we look forward to continue to follow your progress. But for now, Matt, thank you for being with us today.
Thanks, Mike. I appreciate it.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.